And I'm about to make Dr. Puya the host. Okay, so you should be able to share your screen now.
Right. Getting there. Good afternoon, everybody. Thanks for taking time to join us today. Take time out of your busy schedule. I'm happy to get a chance to talk to all of you. So what I thought we'd do first is I do have a few slides that we'll run through to talk a little bit about the program. And then if you have questions at the end, there'll be some time for that. So let me share my screen and hopefully this will work. All right, everyone able to see the presentation, hopefully? All right. Alicia says yes. All right, so welcome to our Department of Nursing information session for 2022. Thank you for joining. St. Joe's has a long-standing history of excelling in the tradition of nursing and educating future nurses. We have been in the business of teaching nursing education since 1932, when the nursing program was first founded by our Sisters of Mercy. So we have a lot of experience training nurses. The department mission here at St. Joe's really is about promoting the growth of the whole person. So not just teaching you the hands-on skills of taking a blood pressure or the anatomy and physiology, but really how we can work on developing you as a professional, how we can educate you on environmental issues and social issues, and really go beyond just the bedside nurse. The other thing that's important for us is that it's based on a foundation of liberal arts, obviously, our nursing program, but also that here at St. Joe's, another big part of our nursing program is that we really work with you and respect you as an individual. So we have very small class sizes. We like to get to know all of our students individually and work to support them and their needs. And our job really is to help you be successful. And so the better we can get to know you, the more we're able to do that and to work with you individually to help you succeed in our program. So hopefully you have an understanding of what nursing is since you're already interested in applying. But really, it's so much more than certainly what you see in the media, you know, on TV or on different YouTube videos or whatever. Yes, it's that by the bedside piece and taking care of our patients, but there's a lot of other roles involved with nursing that sometimes people don't think about. So we educate you on all of those roles. So things like not just being a caregiver, but how do we advocate for not only the needs of our individual patients, but how do we advocate for those in underserved populations, those from different socioeconomic backgrounds, those from different cultures. A large part of what we do with our patients is not only providing care, but educating them on health and wellness, on health promotion, on how to manage their illness, on how to manage their medications. So teaching the patients what they need to do to improve their health and to stay healthy. We educate all of our nurses to be professionals and to be leaders. So many of you at this point in your career might think, well, you know, I'm done with school. I'm going to get my bachelor's. I'm going to go work in hospital and that's it. And hopefully we'll change your opinion about that. But really, as a bachelor's prepared nurse, you are a leader. Even at the bedside, you are a leader as you manage the different aspects of your patient's health, as you work intercollaboratively with other members of the healthcare team, and even including the families in your case management of that. patient. So even when you're just at the bedside, you're a leader. But we start teaching you and educating you about other ways you can be a leader outside of your role at the bedside. Scholar, you'll find that the interventions we're teaching you are all evidence-based on sound current research. We teach you what that research looks like. We teach you how to evaluate that research. And certainly if any of you are thinking about going on next level of education, whether it's master's or DNP, nurse practitioner, you'll need an understanding of research, nursing research and scholarship. And so that's part of your education here as well. We do offer other programs. The Accelerated Second Degree program, which most of you are interested in, falls under our Bachelor's of Science nursing programs, our pre-licensure programs, we call them. But then we also do offer Master in Science in Nursing with either a family nurse practitioner concentration or a psychiatric mental health nurse practitioner. We do have a Doctorate of Nursing Practice program, so your DNP, which is moving, our profession is moving towards that being your entry level for nurse practitioners. And then we offer postmaster's certificates. So plenty of opportunities for you to go on and continue your education once you get that bachelor's. Talking specifically about our Accelerated Second Degree program, the requirements in order for you to be eligible to apply is that all of your prerequisite courses, and we'll talk about what those are in a minute, but all of those need to be within the past 5 years. Anything older than that, you would need to repeat the course, even if you were successful in it the first time, just mostly being that the sciences change so quickly. That we really want you to have a foundation grounded in current practice. So all of your prerequisites within 5 years, you need a B-, preferably or better, but a B- or higher in all of your science courses and cumulative GPA of 3.0. And all of this needs to be completed prior to actually applying for the program. The prerequisites that I mentioned, so you should have an elementary statistics course, a general bio course, anatomy and physiology, both 1 and 2, microbiology, inorganic chemistry, organic chemistry, biochemistry, nutrition, and then lifespan development. So you can see there are quite a few courses that you need to have under your belt before you're eligible to apply. The application deadline was February 1st, and I know it is now February 9th, but we do continue to accept applications as long as there is space available. So if you are interested, it's not too late to apply and then possibly start your courses this May. But I would encourage you to get the applications in as soon as possible while space is still available. We do also need final official transcripts from any and all accredited institutions that you've attended. We will ask for a personal essay, most current resume, and a letter of recommendation. And this can either be academically or professionally if you're in the workplace. Requirements to progress in the nursing major. So once you're in and you get started, you must achieve a B- or higher in all of your, if you're taking science courses with us, but most of you have all those done already. So a B- or higher in all of your nursing courses. You need a cumulative GPA of 3.0. Other things that you will need to complete prior to starting your clinical, which in the accelerated program comes up very quickly, you will need to pass a federal background check and drug screen. There's a long list of health requirements, immunizations, different health physicals, things that you'll need to have as well. You will need to have current American Heart Association BLS for healthcare provider course. If you are currently certified in CPR, but it is from some provider other than the American Heart Association, unfortunately, you will need to have that redone because the majority of our clinical partners require the American Heart Association course. And then there are various technical standards that you need to meet in order to continue your progression. So what does it all look like? So there are components, it's accelerated. So it's, over the course of the 15 months, but parts of it are faster than others. So when you start right away, you'll start with, over the summer, you'll start in May, you'll have 2 sessions. So in your first session, summer session 1, you'll have your Foundations of Professional Nursing course, and you'll start Pathopharmacology 1. That summer session 1 is only a 6-week course, 6 weeks of coursework. Then there's a break, then you'll start summer session 2. Also, which will run over a 6-week period. You'll have Pathopharm 2, and you'll have your health assessment and clinical skills. So this is where you're learning your beginning foundational nursing skills. This is also when you will start your clinical. So after your first 6 weeks, bam, you get you started, and you'll start your clinical rotations during summer too. The fall semester will run at a traditional pace. So that's your traditional 14-week semester. During that time, you will have your med-surg nursing, which will be 1 clinical day a week. And then you'll also have your community public health nursing course, and you'll have a clinical day for that as well. So you'll have 2 nursing courses and 2 full days of clinical. In the spring, again, that's a traditional 14-week semester. During this semester, you will take nursing research course, leaders and management of issues in professional practice course, and then you will take your obstetrics and pediatric nursing course. Obstetric and pediatrics is combined into 1 course. Half of the semester will be obstetrics, and then you'll switch, and the other half will be pediatrics. You will have 1 clinical day a week during this semester, and that rotation will align with whatever you're in. So if you're taking maternity, then you will have your 6-7 weeks of maternity clinical. Then when you switch to pediatrics, you'll have your pediatric clinical, but it will still only be 1 clinical day throughout the semester. After spring, then we move back into summer and our accelerated pace. So summer 1, you're going to be taking your second med-surg nursing course. So this deals with more complex patients, and you'll also have psychiatric nursing, and you'll do 4 clinical days a week. The second summer session 2, which is your abbreviated 6-week session again, this is where you'll do your capstone senior nursing course and senior capstone clinical placement. And again, you'll be in clinical 4 days a week. And then you graduate. Another big piece of our curriculum, in addition to the classes in clinical, is a big part of it is our simulation center. This was just newly renovated and just opened this fall. So we have a beautiful space. If you haven't seen it, go online and check out some of the videos. We have a complete hospital unit, which is what you're looking at here. We have a nurse's station, and we have 6 hospital beds complete with all different kinds of monitors and equipment. In addition to that, we have a simulation center where we have 4 different simulation rooms. And these are the mannequins that are what we call high fidelity mannequins. They're very high tech. So we can hook them up to monitors. We can get vital signs on them. They can talk to us. They can bleed. They can vomit. They can urinate. We can do anything really that we would do with a real patient. We're able to do with these high tech mannequins. So we have 4 rooms for that. And then we have another room that we kind of call our health assessment room with your typical tables like you would see in a doctor's office. We have 10 tables, I think, in that room to practice some of our basic skills. So a lot of wonderful space that we have now with the latest and greatest technology. So we use some of those areas to either practice our skills before we go into the clinical setting or to reinforce skills. So if you have a patient who has a particular procedure that's getting done, or a particular nursing intervention that you need to do that maybe you want to brush up on and practice a little bit before you go to clinical, you can do that in there. And then we have simulations. So where we might run full patient type experiences about things that you might not necessarily get a chance to see in clinical. So we can do that in our simulation room. This space is also available though to you for either individual practice or group practice. There's open lab hours where you can kind of go into the lab at any time and work on some of those skills that you need reinforcing. The woman in the navy blue scrubs in this picture is Elisa Lucas. She is the director of our simulation center and is very much involved. This is just a picture of one of our high fidelity mannequins that I mentioned. This is Victoria. So she's our maternity mannequin. She actually can give birth and hemorrhage, and we can do a C-section if we want, but that's out of the scope of nursing. But she does a lot of very cool things. And so she's just one of the mannequins that we have. So why should you come to USJ? I am partial. I am biased. I will openly admit that. I have been teaching here for about 9 years. This is my first year in my role as director of the undergraduate programs, but I still currently teach. I've been teaching for 9 years, and I'm also an alum here. I loved St. Joe's as a student. I love it even more as a faculty. One of the things that's really key to our success and why a lot of students do choose to come here is, like I mentioned, the small class sizes that we have. You're not sitting in a lecture hall with 100 people for your anatomy and physiology class or your med surg class. Most of our classes, probably the biggest class you would have would be around 30 students. So that's important. We are fully accredited by CCNE, so we are an accredited program. Our most recent data that we have on pass rates, our class of 2020 had a 100% pass rate on our NCLEX, so we're really proud about that. Doesn't get any better than that. Our faculty are very much committed to teaching. You know, that's our main purpose and why we're here. We do have some very talented faculty that, you know, in addition to teaching, are some are nurse practitioners and are currently out in the field practicing, some in practices of their own. We also have a very talented group of nurse researchers that are doing some very interesting work as well. Our clinical affiliations, we have a very long list. The majority of hospitals in the state, I would say we probably go to. And all of your clinical placements are not necessarily all just in the acute care setting. We do things out in the community. We are in schools. We do some work on a mobile van that goes around in the Hartford area and serves the uninsured population. So we try to provide a variety of experiences, both in the acute care setting and in the community. The CAE, as we like to call it, is the Center for Academic Excellence. And that is a center, it's available to all the students, but we have our own dedicated nursing students. And so these are our peer tutors, other students in the program that can help you tutor, help you prepare, help you study, you know, whether it's working on a skill or preparing for the exam. We have a lot of great tutors and we have very good success with our tutoring program. In other institutions, the tutoring center is seen as a negative place to go for kids who aren't smart or, you know, or got in trouble. But here it's very much viewed as a positive aspect and a resource. The majority of our students use it. We've had really good results with it. So that's certainly something that's available to you. And the other thing is that it's free. Some other universities charge you to use the tutoring center, or you only have a certain number of visits. It's free and it's unlimited. We were for a time doing a study abroad experience in Guyana. As you imagine, if that's on hold, we haven't gone since COVID, and there's no immediate plans for that to open back up. things are not going very well with COVID over there right now, and so travel would not be possible. So I can't tell you exactly when that's open. If that's something you're interested in, we can keep it on our radar, but there are no plans currently to get that started back up anytime soon. This is just a list of our nursing faculty and pictures of some of them. We can't get everybody on the one screen, but this is some of the team that you will be working with. And that's all my spiel. I know I go very quickly, but I get excited and I just want to talk about so many things. So that's all I have to say. So at this point, we can stop and open it back up for questions.
So I'm actually enrolled right now. I was just wondering if you guys knew of like a start date or anything, just so I could plan a little bit.
For the second degree program, classes will start May 16th.
Thank you so much.
You're welcome. And there will be information coming out. There will be an orientation prior to that, Jenna. I don't have that specific date nailed down yet, but you will get information with advance notices to when that will be happening and additional information
awesome.
prior to the start date.
Awesome.
Other questions?
Hi, my name is David. I'm also starting this May. I'm completing the physical form, and I was just wondering where I can find the student ID number as long as the USJ email. Is there like a list of instructions to follow for that?
I'll take that, Denise. We haven't released that information yet, so it should be coming out around the time that registration opens for summer and fall, which would be April 4th. So I'm anticipating mid-March before the student accounts will be released, and you will get an email with information about how to initiate all three of your accounts. You'll have a MyUSJ student portal, you'll have a USJ email, and you'll have access to our learning management system, Blackboard. So all of that will be releasing just before, it's usually about 2 weeks before registration opens.
Okay, great. Thank you. I'm about done with my physical. Can I submit it now or should I wait till the email stuff?
Well, you can submit it. It should go right to our health services unit, and I believe the information or contact information should be on the forms.
Okay, great. Thank you so much.
Sure, David.
Other questions?
Hi, I had a quick question. My name is Hodo. I had applied towards the end of January, and I know the program starts in May. I was just wondering how long would the hear back time be?
Alicia, do you have an idea on that?
I think I missed something because I have a couple of chats in the box there. So I'm sorry if you wouldn't mind repeating your question for me.
Yeah, of course. I was just wondering, I had applied towards the end of January and I hadn't heard back yet. I was just wondering how long that would take, the process of hearing back.
Okay. And Hodo, yes. So you're in Dr. Puya's queue for formal consideration. We're all a little backed up. So hopefully we'll be able to get to that. What's today, Wednesday, early next week at the latest?
Yes.
Okay, no problem. Thank you both. Thank you.
You're welcome. Let me interject here because I see a couple of chats. Looks like Sarah is asking, when can we expect to hear back about our application?
Probably in my box too, right, Alicia?
Yeah. As
Now, in my
fact,
defense,
yes.
they haven't been in the box for too long.
That's okay. And we have another question. What is the cost of the program? I'm expecting some changes, but I haven't heard exactly. So I'll quote last year's price. It's a little over $46,000 for the entire 15 months. And it's technically 4 semesters, as Dr. Puya explained. You're doing 2 in the summer, 1 in the spring, 1 in the fall, 1 in the spring, and then 2 more in the summer. So you'll be paying about, for each summer, I think it's $11,600 per semester. And the last cost sheet that I had it broken down over 4 semesters. So count on 11,600 per semester. And there is federal financial aid available. So I recommend, if you are interested in knowing what your allowance would be, just go ahead and do the FAFSA. If you are awarded for FAFSA eligibility and you decide to take it, this program's a little tricky because you have to do 2 years of FAFSA to have continued disbursement throughout the program. So when you're doing it for consideration for May, you're going to need to do the 2021, 2022 cycle FAFSA, and you're also going to need to do the 2022, 2023, if that makes sense. But you'll be getting all of this information, so you don't have to just rely on verbal. Another question. Hi, Fauzia. I got accepted to the program. Want to know when you start interviewing. We don't technically have admissions interviews for this program. I'm correct, Denise, right?
Correct.
Okay, so once we review your documentation and make that decision, you're golden. And then you just start hearing from us about what your next steps would be. Anyone else? Oh, okay, thank you. Okay. Sure, there's got to be more questions than that. Come on.
Yeah.
Allison, you were one of our first admits this year.
Hi.
Hi.
My question actually was about hearing about financial aid. So I think my question is answered.
Okay.
And also as well as the start date. That was one of my big questions.
Okay, excellent.
Yeah, but
And
I'm very
don't pay any attention to the deadlines for the FAFSA. That's all geared to first year traditional undergraduate students. So technically you can apply for FAFSA even beyond the so-called deadline.
okay. So we do start May 16th though, and we will be getting our I was wondering about all of our login information so I could submit all of my health information.
And
all of my
there's usually an orientation like the week before. So
Okay.
you'll be getting advance notice of that as well.
And will that be in person?
Yes,
Oh.
it will.
Mhm.
Yes.
Perfect. So excited.
I shouldn't say yes with such certainty because nothing's certain in the age of COVID anymore. But at this time, we are planning for it to be in person. Yeah, I'd like the opportunity to get to meet you face to face. I can't really meet you too well with a black screen.
I know. I'm sorry.
That's okay. No, but we are planning for it to be an in-person event.
Okay, great.
Yep.
Kelly, did you have any questions for us?
I have one. Hi.
Hi, Fazia. Okay.
Yes. Just wanted to know what timing for classes, like what time do they start? Just an idea, and what time they end, because I have to plan everything before.
In general, our classes run during the day because it's an accelerated session. Typically, if you have a class day, I would plan on being here the whole day, pretty much an 8 to 4 type of thing. It might be 8 to 4, might be 9 to 5, but I would plan on being here the entire day.
Okay, thank you.
You're welcome. And your clinical days as well would be an entire day.
Okay, thank you. Sounds good.
Just FYI too, clinical days can be any day of the week, including weekends. And they can also be either, we don't do 12-hour shifts for clinical, they're 8-hour shifts. So that would either be 7 a.m. to 3 p.m., but it also could be 3 p.m. to 11 p.m.
Hodo has to leave. She has a 1:30 meeting with her professor. So she's just saying thank you and she looks forward to hearing from us soon.
Yep, I will do my best to make my response as quick as possible, Hodo. Thank you for joining us today. Any other questions?
Hi, yeah, I wanted to know how many students are typically in a class? And also another question, are there any loan programs that we can apply to?
I'll let you take the seats, the number of seats, and I'll do the loan question.
So typically, like I said, our classes are small, and so I would say about 30 would be probably, I mean, it might be 31, but around that average, 30 would be your biggest class. Some of our classes, like our health assessment, where you're actually hands-on learning the skills, can be smaller. They might be as small as 15 or so. But around the 30 is the average for our biggest class.
Okay, thank you.
You're welcome.
Loans, if you're not doing federal financial aid, you can obviously look for a private loan through your personal banker. But we don't have any scholarships per se. You might find some scholarships for nursing. The one that I refer most of my MS nurses to is Nurse Corps. I don't know if it applies to a second degree or bachelor's, but you might want to look at that, and it's Nurse Corps, like Peace Corps, CORPS.
I looked it up actually. It does not apply to the AASD program.
Okay.
Yeah.
Okay.
Yep. Thank you.
Okay, you're welcome.
I would say keep looking. Just because there's not something there now doesn't mean in a few months there might not be some for, you know, the later part of your education. There's a big push to increase the nursing workforce right now, and new scholarship grant opportunities are becoming available every day.
Okay, will do. Thank you.
You're welcome. Other questions, comments, concerns, anything you'd like to address with either Alicia or I?
Hi, I have
Hi.
one question, actually two questions.
Okay.
Is there a time cap on your prereqs? Like I took anatomy, so A&P 1, both lecture and lab over, I think 8 years ago, and I did great, but I retook A&P lecture to improve my grade, but I didn't take the lab within the past, was it 5 years? Did you guys have a time cap? Or?
5 years.
Okay.
Yeah, I've never had anyone ask me that question, Alicia. Have you, where they've repeated the class but not the lab?
No, I haven't had that one either. Do you have documents in with us, Angela?
I haven't submitted. I started my application, but the timeline looks like I wouldn't be able to apply till the next, probably 2023 cycle anyway. So I just took a pause on it.
Okay. I would say as long as you did well in the 4-credit AMP initially, then just the lecture should be fine for the retake just due to age.
Okay.
What would you say, Denise?
I would agree. Is that the only prereq that you had an issue with, Angela?
That has the age like that.
The
Yeah.
age. Yep.
Yeah. And my other one was I took general microbiology, and I actually was bummed. I was 1 point away from a B-, but I got a C+. So I wanted to know, is that something I would have to consider retaking again, or? And I know I went to FAU, I'm from Florida, so I went to FAU, and they give nursing students I didn't realize that there was different microbiology classes at my university. So my path was a different one, but I took general microbiology, but I found out there's also microbiology for healthcare professionals or something like that.
And was that within the 5 years, Angela, or was that older?
No, that was last year.
That was last year.
Mm-hmm.
I guess, I don't know, perhaps Alicia, maybe sometimes when there's some uncertainty as to whether or not it would count, we would ask to see the syllabi for that course and see if it aligns with what we're counting as micro.
Okay.
And with the grade, although it's also borderline, I'm looking to make sure that you've done the B- or better in the remaining science related courses. Okay. And then I think in a weighted mentality, we would consider full admission.
Okay, great, thank you.
Welcome. Anyone else?
Christina, did you have questions? Okay, great.
I have a question.
Oh, okay.
Sure.
So if we don't get, you said that no private loans, right? Or, I mean, you guys don't have any loan from the school.
No, there's no
And if we
scholarship.
don't get financial aid, then do we have to pay all in one, or do we get private loan? How would that work? If we
As
don't
I
get
said,
financial aid?
It's
don't qualify.
billed by semester. So, you can arrange to have a private loan that disperses to you every 14 weeks or so,
Mhm.
as opposed, or unless you want to take the whole lump sum out. And then we're not going to hold the money for you because we're monitoring your progress throughout the program. And if for some reason there's a stumble and you've paid for the whole program, we have to refund. So we kind of prefer that you manage it by semester on your own. So that it keeps the accounting and everything straight. But speak to your private banker about it and let them know that cycle should be roughly every 14 to 16 weeks that you need to pay that tuition. I would suggest the payment plan, but I don't think it's valuable for ASD because you have such short terms in both of those summer terms. So I don't think it's a viable option. It would be okay for the fall and the spring, but then the other 2 summer terms, it wouldn't be feasible.
Okay. Thank you.
Mhm.
Okay. Any other questions? Last call. All right, well, I hope we were able to answer all of your questions. Certainly, if you have other questions or concerns that arise, please feel free to shoot us an email and we'll try to get back to you as soon as possible. For those of you that are admitted, congratulations. I hope to be seeing you in May at the orientation. And for those of you that are still in the process, I hope you continue to consider USJ and submit an application. Thanks for joining us today.
Thank you.
Thank you.
Okay. Have a great
Thank you.
day. Yeah.
Thank you.
Have a good day, everyone.